Thank you, Liz. Okay, good to be here, everybody. How's everybody doing tonight? Hey, good. All right, wonderful. So, my name is Michael McEvoy. I'm a nutritional consultant here in Santa Cruz, California. I have a private, web-based, primarily nutritional consulting practice. I work with clients all over the world. I specialize in functional lab test analysis. I've authored 2 books, primarily for clinicians, 1 book on metabolic typing and another book on blood test interpretation. I'm very excited to be presenting this talk tonight. Over the past year, was anybody here last year for the autoimmune presentation? A few of us? So there's been a lot of new discoveries, a lot of new additions to my practice, a lot of new observations I've been making, and hopefully I'm able to share some of this with you here tonight. We're going to be talking about mastering the digestive system and GI tract, understanding function, infection, and immunity. The gut is a great area of interest to me, and anybody that's in the health consulting field, whether you're a doctor, a naturopath, a nutritionist, an herbalist, or whatever, is going to know extensively about the majority of people that come to see them on a regular basis have a compounded amount of gut-related issues. And this has exponentially been increasing over the past several decades, and there's no surprise. So many of the modern epidemics that we see in our society today are so largely either caused directly by gut toxicity, gut malfunction of varying degrees, or that is a major associated component to it. And we're going to be going pretty deep into some of the basic functions of the gut and why this is such an essential and critical, and I'll argue, the most fundamental factor for you to address in your own personal bodies. And if you're a nutritional consultant or a health practitioner, there may be some takeaway information for you that can help you to work with your clients on a deeper level. So let's get right into this. And Liz is going to turn the slides for. Thank you very much. So there's 4 major parts that we're going to look at here today. Symptoms and conditions. We're going to talk about all of the various kinds of symptoms, the most common gut-related symptoms that exist. We're going to look at intestinal function. We're going to talk about the intestinal flora. We're going to talk about leaky gut, otherwise known as intestinal permeability. We're also going to look at stomach functions and conditions. We're going to look at the 2 most common, or probably the 3 most common stomach-related conditions today: gastroesophageal reflux disease, Helicobacter pylori, which is an infection, and we're also going to talk about ulcers. We're going to look at strategies, testing, and solutions. There's going to be a lot of overlap in a lot of these 4 basic categories. We're going to get into all kinds of stuff, pathogens. We're going to get into toxic metals a little bit. We're going to get into some interesting data. Next slide. Okay, so part 1, most common symptoms and conditions that exist, and many of you are probably familiar with these symptoms. Gastroesophageal reflux disease, acid reflux, indigestion, and heartburn, they can all be kind of thrown in the same kind of a category. Just to kind of clarify though, esophageal reflux disease is probably the long-term result of acid reflux, indigestion, and heartburn. It's typically characterized as there being a long-term acid effect on the esophagus or in the mucosal area of the stomach, and causing a breakdown of the tissues surrounding that part of the digestive system. Acid reflux and indigestion and heartburn are probably as old as man. Let's face it, that these issues have been going on for a long time, but there are so many more components that go into what the eventual development of esophageal reflux disease actually looks like. Constipation is a basic common digestive symptom that many people experience. Constipation can be defined as anything less than 1 or 2 bowel movements a day. If there's pain and evacuation of your feces, this may be a sign that you have a bowel flora imbalance. It could be indicative of a lot of different things. We're going to look a little bit at leaky gut, dysbiosis, intestinal permeability. And when we come in to talk about these things, what's interesting is that we need to really understand the actual function of the intestinal region and the importance that it plays in our overall health and our overall immunity. And as we begin to look at the actual function, we can begin to understand and correlate why intestinal permeability, or sometimes it's talked about in medical literature as translocation of various pathogens and particles. We can see why this is so significant once there is this dysbiosis that's present. We're going to look a little bit at some of the other symptoms. Flatulence, it's excessive, chronic diarrhea, abdominal bloating, burning stomach sensations, ulcers, undigested food in the stool, mucus or blood in the stools. pathogenic infections such as Helicobacter pylori, intestinal parasites, bacterial infections such as Clostridium difficile and candidiasis. So I want to point out that these are all symptoms, and the symptoms that you experience can be viewed in a couple of different ways. Many people that contact me want to get rid of their symptoms, and understandably so. If you have any basic digestive symptoms or gut-related symptoms, you want to get better. You want to get rid of them. This is such a fundamental thing, right? But I think that it's easy to overlook the importance of what the symptoms are indicative of. If you're only addressing the problem from the level of the symptom, without addressing causation, without addressing the actual loss of function, physiologically speaking, you're not getting to the root of the problem, and furthermore, certain types of symptom treatment can be very dangerous, especially long-term. We're going to look at the long-term side effects of certain pharmaceutical medications on the gastrointestinal system. So the other important thing I want to say about symptoms is that symptoms can be your greatest teacher sometimes. They can tell you a lot about yourself. Ignoring your symptoms is not a good way to view healing the body, because you're pretending like these symptoms aren't there, or you're taking something that's masking the symptoms. If you have esophageal reflux disease and you're taking a proton pump inhibitor or an H2 blocker, this is just symptom treatment. And not only that, there could be long-term side effects associated with taking these medications. So we want to view symptoms as an important teaching model to understand the level of dysfunction that exists in your body. And furthermore, we want to learn from what the symptoms are actually indicative of. We want to actually investigate where the symptoms are arising from. So there's a definite distinction. Next slide, please. And then see, these are some more of the serious gut conditions that can arise. And I want to also say that, you know, sometimes people think that, oh, just one day I woke up and I had Crohn's disease. Oh, one day I woke up and I had lymphocytic colitis. Oh, one day I woke up and I had diverticulosis. It doesn't happen like that. There's a cause and effect for everything. Disease doesn't just appear out of nowhere. And it's the case, it's the truth, if you investigate these issues deeper, that when you have these particular conditions arise, these degenerative diseases, these chronic illnesses, there's a long-term progression of patterns that you were not cognizant of, or you did not address fully enough to identify that something was amiss, something was wrong. You didn't look at the symptoms close enough. You didn't analyze the symptoms, or the treatment that you were doing was not effective at mitigating the symptoms, and furthermore, the entire issue wasn't being addressed from a holistic perspective. And this is a big problem, because a lot of these diseases can be prevented simply by understanding the level of causation that exists when you investigate where the symptoms are coming from. But that's not done today in too many different allopathic circles. Most people are just given symptom treatment and told that they should just deal with the problems that they have, take the drugs, don't ask any further questions, and that everything is fine. But the major problem with that is that there's serious repercussions, and furthermore, the actual root of the issue is never investigated fully. So these are just an indication that your diseases are a progression. They don't just arise out of nowhere. I guarantee you that if somebody has one of these issues, there was something or many things likely that they were doing that were not optimal for their body. And this is going to involve everything from toxicity and nutrient deficiencies and stress to pathogens and overgrowth of commensal bacteria and all kinds of things that led up to the development of these said conditions. Next slide, please. So this is a quote from Hippocrates, the father of Western medicine. All disease begins in the gut. And it's important to point out that this was spoken almost 2,500 years ago, but as you begin to research the current medical research that's coming out, you're beginning to see that Hippocrates was very largely correct, at least in this specific quotation, that there are tremendous links to the whole groups of disease processes are now being seen to originate in a dysbiotic and in an imbalanced gut. Not only that, but there's a whole variety of different disease processes that may not seem to include the gut toxicity, but in fact, the origin of those diseases has a direct link to intestinal inflammation and intestinal dysbiosis. Conditions such as thyroid conditions, autoimmune diseases, adrenal fatigue, skin-related issues such as psoriasis, eczema, rashes, and acne, headaches, migraines, and cluster headaches, which could be triggered by food intolerances or food sensitivities, joint pain and inflammation, asthma, allergies, autism is heavily influenced by gut toxicity, chronic fatigue syndrome, fibromyalgia, depression, anxiety, and even psychiatric illnesses. So I could literally just list off probably 500 peer-reviewed articles that talk about each one of these different conditions and the specific link to gut toxicity as being a central issue, if not the primary etiology, for the development of the symptoms. So when we get into why the intestinal function is so critical, we'll learn about the importance of the intestinal flora and how this is a major part of your immune system, actually regulating the inflammatory cascades of the body. Next slide, please. So this is an example from one peer review from the September 2008 issue of the Mucosal Immunology Journal, Joint Expedition Linking Gut Inflammation to Arthritis. And the major quote that I took from that is, subclinical gut inflammation, which can be considered as a model for early Crohn's disease, was shown to be strongly associated with joint inflammation. So this is important to point out, is that if you have peripheral inflammation, meaning if you have distal parts of your body, the arms, the legs, the joints, that experience pain, or if there's swelling and inflammation in the joints of the body, the first thing I would begin to investigate is intestinal inflammation and gut dysbiosis and gut toxicity. And we'll understand as we begin to delve into this why that's specifically the case. So there's, next slide, thank you. That's all right. All right, so as we get into this next section, intestinal immunity, your gut flora, 80% of the immune system of your body resides inside of the gastrointestinal tract in the form of bacteria known as gut flora, or intestinal flora. There are approximately 100 trillion microorganisms that line your gut, nearly 10 times the amount of cells that make up the human body. Healthy gut flora maintains healthy gut functions, including proper stool formation, bacterial balance between various bacterial species in the gut, the synthesis and the fermentation of certain B vitamins, as well as vitamin K2, the synthesis of certain digestive enzymes, as well as the assimilation of nutrients from your food. Your gut flora modulates inflammatory responses, cytokine signaling, and immune signaling. Your gut flora communicates directly with your brain via the vagus nerve. Did anybody happen to read that article that Liz put out, that I wrote about the intestinal flora and the balance of your brain neurotransmitters?
It's in the newsletter that just came out, so if you're on the website, if you're on our newsletter, you would get it, and if not, that's the one that's sitting over there, and you can take it off the web as well. So
we'll look specifically at how neurotransmitters are synthesized in the gut and are largely stored in the intestinal mucosa. And there's several peer reviews that are coming out by the week that are talking about this exciting new research. Your gut flora communicates directly with your brain, as I just said, via the vagus nerve. Imbalances in gut flora and gut toxicity are at the root of many disease processes, including inflammatory conditions, autoimmune conditions, behavioral disorders, depression, and anxiety. Next slide, please. Okay, so looking here at some of the bacterial colonies that line the gut. There are more than 500 total species, somewhere between 400 and 1,000. Science doesn't exactly know the exact number, but it's somewhere between 500 and 1,000 total bacterial species that line the gut. More than 100 trillion microorganisms. That is unbelievable. That's 10 times the amount of cells that are in the human body. Your gut is literally an organism within an organism. And as we're going to learn about what the gut is doing with the central nervous system and how it's communicating the brain, it's absolutely flooring that the more we begin to learn about the gut, the more we're going to learn about disease. Beneficial intestinal flora, there's the major species of the lactobacillus species, E. coli, bifidobacterium, and there's hundreds of additional species of beneficial intestinal flora. Then we have another kind of flora called the opportunistic flora, and these are potentially pathogenic. These are bacterioids, peptococci, staphylococci, streptococci, bacilli, clostridia, yeasts, enterobacteria, fusobacteria, eubacteria, and cantanobacteria. So I want to bring up a few points here, is that the gut is largely, the intestines are largely a fermentation chamber. There's trillions of microorganisms. The complexity of the the interaction between these bacterial species is remarkable and is largely not even known to modern science. But if you break down all of the different species, they basically fall into one of two categories. They're either going to be beneficial, meaning that they're going to be a major important part of intestinal immune function, or they will potentially be pathogenic, or what's called opportunistic. And so there needs to be this balance. Everything in health is about homeostasis. Balance between yin, balance between yang, balance between acid and alkalines, sympathetic and parasympathetic. And the same is true for the intestinal bacteria, is that you have to have the right proportion of the good guys, and you need to have some of these opportunistic flora that make up other things as well. Problems will arise when these opportunistic bacteria become pathogenic, when they overgrow. And we'll look at some of the reasons why this may be taking place. But these are very common to see today if you run a stool test or if you've ever had a comprehensive stool analysis and you see any of these opportunistic flora organisms high, you know that you likely have intestinal inflammation to some degree. The greater, the more severe the digestive symptoms, the more common it is to see an increase in these opportunistic microorganisms. Many of us are familiar with Candida or Candidiasis or Candida albicans as being a necessary yeast that exists as part of the flora of the body. But as we know, this yeast can overgrow under certain conditions when the opportunity is right and can cause all kinds of problems in the body. When we look at leaky gut and intestinal permeability, these opportunistic organisms become a major point that we have to look at closely. We have to put these under the microscope, literally and figuratively, and say that if we don't get the intestinal permeability under control, we're going to have a lot of systemic inflammation going on in the body. Next slide, please. So pathogens harbor toxic metals as well as minerals. This is something that's little known, but this is a fact. As much as 50% of the dry weight of pathogens may be toxic metals such as mercury, lead, aluminum, cadmium, nickel, and arsenic. Certain pathogens can harbor iron and ferritin and can even cause anemia. If ever I look on a blood test and I see either a very high level of iron or a very low level of iron or altercations in the ferritin, I may consider that that person has a pathogenic infection going on, especially if the uric acid is elevated. So it's important to point out that toxins, that I should say that these opportunistic flora and bacteria and pathogens can harbor all kinds of different metals and minerals. An example of these would be Candida is well known to harbor mercury, ion, as well as iron. And it's quite the case in many instances that if a person does have a candidiasis infection or an overgrowth of yeast, and if this is a chronic issue that's persistent, and all dietary interventions are not significant or not enough to improve the yeast imbalance, then the next thing I'm looking at is mercury toxicity. And it's no surprise that Candida harbors mercury, and once the intestinal flora is corrected, and once the toxins are addressed, and once you address mercury toxicity and you address mercury detoxification and enhancing the normal biological pathways of detoxification, the Candida starts to correct, the yeast starts to correct. Candida can also harbor iron. The bacteria Pseudomonas can harbor mercury as well. Helicobacter pylori, which we're going to look at, which is a stomach pathogen that lives in the pyloric part of the stomach, harbors cadmium, which is a toxic metal, nickel, which is also a toxic metal in high amounts, and also H. pylori, and I should also mention that other pathogens harbor not only metals, but also important minerals, such as manganese. Does anybody know what manganese is? Anybody heard of this important trace element? Manganese. Manganese is essential to form certain antioxidants in the body, such as superoxide dismutase, which is found in all cells of the body. It's very common that if a person has an H. pylori infection, they have a high level of inflammation. It's already going on, especially if they're symptomatic. If they have the symptoms of H. pylori and it's positive on a stool test or a urea breath test, this is a major cause of concern. And we want to look not only at the pathogen itself, but also what the pathogen is doing to the rest of the body. Okay, Klebsiella, Listeria, and the parasite Entamoeba histolytica have all been documented to harbor iron from the body, steal it, hijack it, use it for its own purposes. triggering a disruption of iron metabolism in the body, causing depletions of iron, which of course iron is necessary for red blood cell formation and hemoglobin synthesis. Staphylococci is known to harbor aluminum, and it's been clinical observations of many people, many clinicians, that once you start seeing high levels of aluminum coming out of the body, either on a hair, or urine, or fecal metal test, it's suspected that a person is dumping Staphylococci. That's been eliminated. And so aluminum gets freed up as you start wiping out these pathogens. Lyme bacteria is known to harbor manganese as well. So these are just an example of some of the pathogens that harbor certain metals and minerals, but there's probably hundreds more that are not well documented, but these are probably the most well documented. Any questions about this before we move on?
I have one.
Yes?
How do we detox? Are we going over that?
Yeah, a little bit. I'm not going to go into that extensively, but I mean, to answer that question, I will say that by enhancing the normal biological functions of the body is capable of detoxifying metals and chemicals to a certain degree, of course, but by giving the body what it needs, by supporting transsulfuration and glutathione conjugation and antioxidant synthesis in the cells, the body is more capable of eliminating heavy metals. But also it's twofold, because if a person has pathogens and the pathogens are hijacking metals, the enzyme systems of the body and the antioxidant defenses of the body, like metallothionein and glutathione, are oftentimes not able to break down these pathogenic biofilms. One of the important things I want to bring up, since we're on this discussion of pathogens, is that one of the new things in the literature that is coming out are what's called biofilms. Has anybody heard of biofilms? So biofilms, it's now been shown that pathogens, they don't live by themselves. A lot of them live in colonies, and these colonies are often referred to as biofilm. A lot of the new therapies that are existing in alternative healthcare involve breaking down these pathogenic biofilms so that these pathogens can be more easily excreted from the body. And there are certain enzymes that can help us do that. One more question.
Why would Lyme create a higher level of manganese?
Well, it's probably because of its own life cycle. Probably because it's hijacking it for its own life purposes. It's not known exactly why certain metals are being harbored by certain minerals, by certain pathogens, but they are. So that's certainly to be the case with Helicobacter, is known to use vitamin B12, which derived from cobalt specifically, and other minerals as well, for its own purposes, to create the urease film, to create its environment, basically.
So that goes to my question, then supplementing with manganese or supplementing with iron wouldn't exactly be a treatment choice, because it would just feed the
So the question is, would supplementing with manganese or iron be potentially harmful if a person had these types of infections? I would say absolutely. Absolutely. And that's simply because, I mean, it depends on each situation, of course. But I never recommend iron supplementation anyway, because it's just a very reactive and volatile mineral. It's a radical when it reacts with oxygen. So we're going to move on to the next slide. We'll save more questions for later. Next slide, thank you. Okay, so this is a close-up of the intestinal wall. And we have here, the villi are these very small finger-like hairs on the intestinal walls. They are fundamental for nutrient absorption. Digested amino acids from protein and simple sugars pass directly into the bloodstream, through the capillaries. Fats and lipids are carried into the lymphatic fluid via the lacteals. The microscopic microvilli, which are those diagonal lines at the top of the oval there, you see? So the microvilli secrete tiny digestive enzymes which are essential for nutrient absorption. Leaky gut may develop into a serious condition known as villous atrophy, in which the villi and the microvilli are severely compromised and nutrient absorption is very, very poor. So as we look at the illustration here, the villi are these finger-like hairs and the microvilli are even tinier. This is how you digest and assimilate your food. These structures are in the small intestine, thousands of them, and if you look at them up close, they're commonly referred to as the brush border, because they look like a very fine, kind of bristle type of a brush. But the reality is that these tiny, tiny, tiny microvilli are secreting the digestive enzymes necessary to finalize the digestion and the eventual assimilation of your food and nutrients. which will be compromised when there is a degradation to that mucosal lining that these villi live in. When there's a high level of toxins, a high level of pathogens, this is a very common situation to see the microvilli are severely compromised. And as a result, I see commonly on hair elements analysis or hair analysis, the minerals are all very low because they're not getting into the cell, they're not being absorbed through the intestinal epithelium. There's a lot of toxicity that needs to be addressed. Next slide, please. Thank you. So leaky gut, intestinal permeability. This is how I see it. The main causes: toxicity, heavy metals, chemicals, antibiotics, and pharmaceuticals, which will, just to make the point, antibiotics, anti means against, biotics means life. Antibiotics have a devastating effect upon the gut flora. They will destroy whole colonies of intestinal flora, as well as derail the communication network between the intestinal flora. Pharmaceuticals are well documented in the literature, various kinds, to cause different levels of toxicity. Other main causes of intestinal permeability include nutrient deficiencies. The body needs nutrients continuously to regenerate through anabolic responses and anabolic processes. In order for your tissues to regenerate, you need certain things. You need protein, amino acids. You need nutrients. You need nutrients to reform and regenerate tissue. Pathogens and a very high inflammatory response. Pathogens, when you have a leaky gut, and this is a key point, when you have a leaky gut, what does this mean? So you have this mucosal barrier from mouth to anus. And this is the major line of defense of the body. This is the first line of defense against any invading antigen or pathogen. The immunoglobulin IgA, has anybody ever heard of IgA? Immunoglobulin A is found in the highest concentration in the intestinal mucosa. And the intestinal mucosa line is also, there's mucosa in the lungs and in the bladder, and the urinary tract, as well as in the stomach, as well as in the intestines. So when you have intestinal permeability, you have a compromise. Your mucosal barrier, these tight junctions that exist between the villi and the microvilli. This brush border is broken down, it's atrophied, it's damaged. And so as a result, pathogens and opportunistic organisms, as well as toxic metals and all sorts of toxic things, pass directly into systemic circulation. The medical literature is very, very clear to document and to demonstrate that pathogens, once crossing through into systemic circulation, invoke tremendously high amounts of pro-inflammatory cytokines, not only to parts of the body such as the synovium and the joint capsules of the body, but also the literature has documented that pathogens invoke high levels of inflammation to the brain and the central nervous system as well. So the intestinal barrier, the intestinal mucosal barrier, is a guard. It's a gate that prevents toxins from crossing over into systemic circulation. And today we're seeing such a tremendous incidence of intestinal permeability, intestinal toxicity, that it's no surprise that the epidemic of autism and other degenerative diseases is so tremendous. Stress overload, the adrenal cortisol connection. So cortisol is like it's a stress lubricant hormone. It's secreted by the adrenals, the adrenal glands, which reside just above the kidneys, and they're tiny little glands that secrete teeny tiny little amounts of hormones. And one of the major hormones that they secrete is cortisol, which is an absolutely essential hormone. But cortisol also functions as an anti-inflammatory hormone. That when you have inflammation, one of the body's defenses is to produce glucocorticoids as a defense mechanism against the inflammation, against the tissue breakdown and destruction and free radical activity that's causing the degeneration of tissues. So it's common to see people that have a strong intestinal inflammation, altercations in the cortisol rhythm. That you may see very high levels of cortisol, you may see very depressed levels of cortisol. You may see differences in how the cortisol rhythm looks. If anybody here has ever had a cortisol test, saliva hormone test, you may also look at the 4 different cortisol patterns throughout the day. This is why so many laboratories in the United States that offer saliva testing as well as stool testing, they recommend that you do both together, because it's such a common presentation to see stress responses associated with chronic inflammation. Food intolerances and food allergies are another cause and component of intestinal permeability. Food intolerances can be anything at all, Probably the most common food intolerances are gluten and gliadin, which it's estimated that some 70 to 80% of the population has a gluten or gliadin intolerance to varying degrees. Other common food antigens and food sensitivities include, in some cases, milk, especially pasteurized milk, or eggs, cheese, dairy, soy, corn. These are common. It's probably the best way to know for sure is you do the Dr. Coca pulse test. Anybody heard of that? At-home way to kind of assess if you have a food sensitivity. Look it up, COCA, Dr. Coca pulse test. It's a 50-year-old, Dr. Coca was an MD back in the 50s, and he developed a systematic and verifiable way to determine if there was a likely a food reaction taking place. So the other thing that I want to talk about in relation to food intolerances and food allergies is that when you have a leaky gut, when you have intestinal permeability or a translocation of pathogens to different parts of the body, this will invoke immune signaling. This will invoke inflammation. And so food sensitivities may be heightened in people that have leaky gut. They may have, suddenly after eating bread or eating something, they get a headache or a migraine. Or it may not even be a digestive symptom. They may have inflammation in their joints. I'm sure we can all probably attest to many people that we know that have some of these reactions to gluten or to other foods specifically. So what's essential is to eliminate whatever the food intolerance is, but to also at the same time concomitantly work on the condition and the function of the gut. Bowel flora imbalance, which may be a major underlying factor. That may be like number one on the list. There's so many factors that influence and destroy the intestinal flora of the body. I mentioned antibiotics and pharmaceuticals have a devastating effect. But also, I should say that intestinal flora can be damaged if you weren't breastfed, because this is one of the number one ways of implanting the gut flora into the infant is through the drinking of the mother's milk and the colostrum. So, but there's other things that can damage the intestinal flora. Pesticides and chemicals and heavy metals all have a devastating effect on the healthy gut flora.
Alcohol?
Alcohol, sugar, excessive foods that will just irritate the gut lining. Genetically modified foods, very well made. And the list goes on and on and on and on and on about things that may have a devastating effect on the bowel flora. Do you have a question or something?
Oh, are you going to add in about how cortisol affects the gut lining renewal also?
Totally. Well, the thing is that you know, having to realize that cortisol has an anabolic defense. It has a short-term anabolic defense, but long-term, cortisol has a catabolic effect. And so do other glucocorticoid hormones. That's why if you take prednisone long-term or hydrocortisone long-term, you're at a greater risk of developing osteoporosis and osteopenia because the glucocorticoids in high amounts have a catabolic effect on the gut lining. So it's essential to get the stress and everything under control. Main tests to detect leaky gut intestinal permeability. This is something that I've made reference to, and I found that it's not a definitive indicator, but it's a crude indicator. On a routine blood test, if you see elevations in the uric acid level, 5.0 or higher, and if this is accompanied by either high or low lymphocytes, which are a certain type of white blood cell, this is a strong indication of gut dysbiosis. Why do I say uric acid? Well, uric acid is a mycotoxin. It's a fungal metabolite. And quite common that when there is dysbiosis present, the uric acid is hovering around 5 or even greater than that. And the lymphocytes are a key white blood cell that are found in high concentrations, in the intestinal epithelium. And the lymphocytes are also the producers of the Th1 and Th2 helper cells, which modulate the inflammatory cascades of the body. Th1 modifies tumor necrosis factor alpha. Th2 response initiates other inflammatory interleukins. So if you see a higher low lymphocytes on a blood test, this may be an indication that there's some level of inflammation, and it may be intestinal. But it's not definitive. It's just a crude indicator. A stool test is probably the best way to kind of get a sense of what's going on. We're going to look a little bit more at this later. It's more specifically, high or low IgA levels on a stool test is indicative of varying degrees of intestinal inflammation. If you see high or low short-chain fatty acids on a comprehensive stool test, short-chain fatty acids, just to let you know what that is, SCFA, short-chain fatty acids, are produced from fiber. And what they do is they basically cause the colonization of various intestinal flora, intestinal bacteria. So if you see these are very low or very high, it indicates that there's something going on inflammatory-wise in the gut. Increased opportunistic organisms on a comprehensive stool test, quite obviously the case. If you see a low beneficial flora level, if you see lots of pathogens in the stool, then this is likely a situation of inflammation. A salivary, some labs use a salivary IgA test that could indicate high or low IgA levels as well. Some people would argue that the salivary IgA is more accurate than the stool, which is still debatable. Primary ways to correct intestinal permeability. Got to follow an individualized type of a diet. Not everybody needs the same concentrations of nutrients. It's essential to point out that there's no such thing as a one-size-fits-all kind of nutrition plan, let alone a one-size-fits-all type of a diet. Some people need much higher concentrations of animal protein. Some people need far less animal protein. I've seen it all in those regards.
How do you figure that out?
There's various tests that you can do. I use a system of nutrition called metabolic type nutrition. Metabolic typing is a way to get a basic sense of what an ideal diet should look like. But there's so many ways to individualize a nutrition plan. Different lab tests can be used to really get specific with exactly how and what nutrition plan an individual actually needs. So we need amino acids to regenerate tissue. Protein is an essential component. Some need more protein, some need less, some need more of certain amino acids, which we're going to look at later. Other primary ways to help correct intestinal permeability: remove antigenic foods, which goes along with the food intolerance part. Remove the offending toxins and pathogens that are compromising the gut lining and are inciting high levels of inflammation. This is essential. If you have pathogenic infections going on, and you have especially toxic metals, toxic chemicals, your body's not getting rid of them, this is a major, major cause of concern and has to be addressed in anything seriously trying to address the intestinal function. Implanting the intestinal flora, aka probiotics, and things that will help to colonize the intestinal flora. I think that this is absolutely essential in this day and age, is that I think everybody should be taking some kind of a probiotic, whether it be an actual capsule with lab bacteria in it, or cultured foods, which could also help to colonize intestinal bacteria. Again, there's no such thing as a one-size-fits-all approach. Later in the section, in the last section, when we look at testing and solutions, we're going to talk about certain strains of bacteria which have been documented in the literature to have an important and beneficial effect on the gut. And additional supplemental support, which we'll look at later. Next slide. Okay, gut health and brain function. Your gut is in fact your second brain, referred to as your enteric nervous system. Your enteric nervous system has its own network of neurons and neurotransmitters that think, communicate, and learn independently of your brain. Your brain does not necessarily tell your gut what to do in all cases. In many cases, your gut is actually going on its own accord independently of the central nervous system. That's astonishing, but it's a fact. 95% of the serotonin that's in the body, which is one of the primary brain neurotransmitters, is found in the gut, is stored in the enteric neurons. 95%. Imbalances in serotonin are believed to be at the core of depression, bipolar, anxiety, migraine, sleep disorder. I should also say autism, and anything along the autism spectrum, schizophrenia. Another key neurotransmitter, GABA, is also found in the gut. GABA affects mood, sleep, and cognition. So there's actually over 35 of the neurotransmitters of the body found in the enteric neurons in the gut. And they all have a direct connection to the brain. Antidepressants and psychotropic medications may directly affect the gut. And this is why so many people that have been taking psychotropic medications or antidepressant medications long-term may be at risk for having gut dysbiosis. And I've seen this many, many times. Next slide, please. I think it's about... So, okay, before we get into this, so I want to just explain that process of how can you go back to the last slide?
You tell me how.
It's just the back button, the one right next to it. You don't need to if you can't find it. Thank you. Oh, the other one. Two back now. Peggy's got a Mac. So there you go. Thank you. Okay, so I wanted to talk about, this is such a fascinating subject. I don't want to pass this up. So I want to tell you how does this happen? How does this work? So you have millions, tens of millions of enteric neurons in the gut mucosal lining. And these enteric neurons, they do a lot of different things. They hold and they use neurotransmitters for different purposes. Some studies have even shown that many of these neurotransmitters, the serotonin in the gut, a large percentage of that, can actually prevent certain inflammatory diseases, such as osteoporosis. It's been shown in the literature to do that. But it's still not totally known. It's believed that these gut neurotransmitters have a direct effect on the brain, but it's not totally certain how it's being done. One way that it's being speculated that it's being done is that, so you got all these enteric neurons in the gut, millions and millions of them, and they're talking to each other. But they can also tell the brain what to do. They can function independently of the brain, but they also communicate with the brain, and they send different signals to the brain. What's been shown in literature is that the bacteria in the intestines actually tells the enteric neurons to excite or to calm down. The bacteria is telling the neurons what to do. And this has been demonstrated over and over again in various peer-reviewed research. This is astonishing that we are bacterial organisms by nature, and the bacteria is telling these complex organisms in the body what to do and how to behave. That's remarkable. So I wanted to make that clear, that the importance of the intestinal flora on brain cognition is now documented in literature as such. Next slide. Okay, gut microbes and inflammation. Intestinal flora modulates gut mucosal immunity. So again, 80% of the immune system in the gut is that commensal bacteria, is that intestinal flora, is the first line of defense. That mucosal barrier is critical to prevent pathogens from going into the systemic circulation of the body. Pathogens and an overgrowth of bacterial microbes such as streptococci infection, Clostridium difficile. Clostridia are documented inside high levels of inflammatory cytokines, which are signaling molecules that incite tissue damage, tissue destruction, breakdown of brain function, different neurons being destroyed by cytokine activity. So anybody that has any autoimmune conditions knows about cytokines or cytokine-inhibiting medications and the role that cytokines play in the inflammatory response. Inflammation is systemic and involves the brain and nervous system. The inflammation is derived from intestinal dysbiosis and a loss of mucosal barrier function in the gut, which allows pathogens to escape into circulation. So again, you've got to have that gate, you've got to have that barrier to prevent toxins from going into the bloodstream, from triggering high levels of inflammation. And this is one major reason why I think Hippocrates somehow knew, I don't know how he knew, but that so many diseases originate in the gut, even though they don't have to do with the gut directly. Cognition issues, autism, mental illness, chronic inflammation, joint inflammation. These issues, which are found in distal parts of the body, further away from the center of the body, these are being triggered by high levels of inflammation from a leaky gut or a gut toxicity. Next slide, please. Okay, so let's talk about overview of stomach digestion. Before we do that, any questions on the gut, on the intestines?
Yes.
Yes.
Very quickly, when you talked about the pulse test, I have leaky gut for like 10 years, but I have a nephew that's just claims he has it. But when I tell him to take his pulse, he says, which is true for some, that his allergies are always 48 hours later, 24 hours later. So does the pulse test accurately if you're having allergies?
No, that's a good question. The COCA pulse test is for an immediate immune reaction. There are different types of immune reactions. The question was, does the COCA pulse test, can that show delayed food sensitivities? And the answer is, as far as I am aware, no. It's showing that the COCA pulse test, you put an offensive food on the tongue, and if it raises the pulse by 5 to 10 beats per minute more, there's a likely an immune reaction that's taking place as a result of that. But not all, there's many different kinds of immune reactions, food sensitivities. There's delayed food sensitivities, there's mast cell food allergies, which are less common. There's different kinds of immune reactions. So the COCA pulse test is just kind of a preliminary thing. There's other ways to determine, like an IgG food sensitivity test, which is very common and I think very effective to identify food sensitivities that are more delayed. One more question before we move on.
I was curious if there's a drastic form of implanting organisms, not to gross anybody out, but fecal transplant therapy?
Yes, thank you. Good question. So it's documented in the literature that fecal transplant therapy is a highly effective way at actually reversing Clostridium difficile infection. Has anybody heard of Clostridium difficile, C. diff? C. diff is a virulent pathogenic infection that's so often caused by two things. One, the overuse of antibiotics. Two, the overuse of proton pump inhibitors. And three, overall intestinal dysbiosis. C. diff is an anaerobic pathogen. It lives without oxygen. And it's a very, very pernicious, and in many ways can be life-threatening pathogenic infection. But fecal transplant therapy, that transplanting a healthy person's feces into your own colon, is actually an effective way to get rid of Clostridium difficile. Before that, I would like to try a few things first. See, and so before I recommend that, I want to see if, well, maybe we don't have to implant somebody else's stool into your body first. Let's try some oxygen therapy. Let's try hyperbaric oxygen therapy, or let's try ozone therapy, or rectal ozone insufflation. Why? Because C. diff is an anaerobic pathogen that lives without oxygen, and if you introduce high amounts of oxygen, it reacts and it kills the pathogen. This is true for a lot of anaerobic pathogens. So I'm likely going to recommend that first. But I have recommended C. diff, the fecal transplant, and it did work to a client of mine. So she was happy about that in the end. To get rid of the infection. To get rid of the infection. One more question about the intestines before we move on.
So could you do an enema with probiotics and prebiotics, and would that kind of plant the good and bacteria up in there?
I wouldn't do prebiotics just because prebiotics can feed pathogenic microorganisms if you have an overgrowth already. And you could do a colonic with bifidobacterium, but I wouldn't recommend any other type of bacteria other than bifido. If you're going to do that, if you're going to shoot it into an enema, but I would probably recommend the oxygen therapy over that. You could still do the bifido implant if you wanted to, but I don't think it's really a pernicious infection to get rid of. So I would try to approach it probably from a number of different perspectives all at once. And then if that doesn't work, the stool is what you get. The implant is what you get. Okay, so the next section, let's talk about the overview of stomach function and stomach digestion. Digestion begins in the mouth. The act of chewing your food releases enzymes. So did you know that you should sit down, and when your mother or your grandmother told you, sit down and eat and chew your food slowly. Don't eat on the go, don't eat in your car, but chew your food slowly, because when you chew your food, the saliva mixes that it contains major enzymes. Amylase is the primary enzyme that's found in the saliva, but also proteases and lipases in smaller amounts are found in the saliva. And by chewing, you're basically beginning the process of pre-digestion by chewing your food slowly. So pre-digestion of foods takes place in the mouth, and then in the stomach, when you swallow your food, 20 minutes before your stomach starts producing acid, high concentrations of it, it's believed that the human stomach, and this is known about other animals, but it's even believed that the human stomach has a pre-digestive phase. This is why you want to take your plant-based digestive enzymes at the beginning of the meal rather than the end of the meal, is because it's working to pre-digest your food, and studies at Northwestern University have shown that pre-digestion in the stomach can actually digest 60% of the carbohydrates that you've consumed has happened in pre-digestion before it gets to your small intestine. Hold on one second. So you want to make sure that you're chewing your food slowly, making sure that it's mixing with saliva. It's there for a reason. There's a reason why you start secreting saliva when you smell food that you really like. It's because your body is signaling that you should begin starting the digestive process. Maybe your stomach starts gurgling when you start smelling some food and then you're hungry. It's because your body is signaling, I need to eat, and the digestive organs are secreting various fluids to prepare you for the digestive process. So after about 20-30 minutes into the meal is when the stomach starts secreting hydrochloric acid. And the parietal cells, the cells that secrete the acid, are called the parietal cells. The parietal cells lower the stomach pH. Now, it's misbelieved. It's not true that stomach acid digests your food. Stomach acid does not digest your food per se. It lowers the pH of the stomach so that another enzyme called pepsin, which is released by the chief cells, pepsin is what actually masticates your protein and breaks it down. But stomach acid is important for freeing minerals from your food and mineral supplements. If you don't have stomach acid, you can't assimilate minerals very well. And this is documented in literature. We'll talk about that. So most or all of these digestive functions are either fully or partially regulated by the enteric neurons in the gut. So another major function of the enteric neurons is to regulate, or at least be involved in the regulatory process to some degree, of most of these digestive organs. The liver, the stomach, the bile, the enteric neurons are in the biliary duct and in the gallbladder. The enteric neurons are in the pancreas, secreting pancreatic enzymes. So your food gets swallowed. As you're looking at the image there, the stomach is on the right side. It's actually on our left side, but the picture's on the right. So the food drops to the bottom of the stomach. The acid gets secreted by the parietal cells. Pepsin gets triggered. And then slowly there's a little valve at the bottom of the stomach, which you can't see on this illustration. But it basically connects the pyloric, the bottom part of the stomach, with the what's the first part of the small intestine?
Duodenum.
Thank you. The duodenum. So the food slowly passes into the duodenum, where digestion begins to get initiated. And the duodenum is where the gallbladder secretes bile, and where the pancreas, which is in the center just below the stomach, secretes pancreatic enzymes, alpha-chymotrypsin, and trypsin. And then that's where the real final processes of digestion take place in your small intestine. So if you take a digestive enzyme supplement, it's being reactivated in the stomach, in the small intestine, especially if it has a wider pH range, a plant-based enzyme. So then the digestion goes on, and in the middle of the small intestine is called the jejunum, and that's where the final stage of carbohydrate digestion takes place. And a close-up view of the small intestine reveals those tiny little finger-like hairs that secrete the digestive enzymes, and then the nutrients get absorbed into systemic circulation and into the lymphatic fluids, and so that's how digestion and assimilation takes place. All kinds of problems can go wrong in a toxic gut or pathogens or infections. Next slide, please. Let's take a look at what some of these are. So GERD, esophageal reflux disease, acid indigestion, and ulcers. GERD symptoms commonly include acid and or partially digested food in the throat between meals or after meals, possible burning stomach sensations on the left side, flatulence, bloating may accompany. GERD is the result of long-term acid reflux, typically involves severely damaged gastric and or esophageal mucosal tissues. So the acid is coming up. So the question is, why does this happen? Isn't the stomach supposed to be acidic? Absolutely. Ulcers. Symptoms may include burning stomach, pains, especially during meals. Person in severe ulcer situations may be vomiting blood, may have serious acid reflux issues. The conventional treatments for GERD and reflux include acid-blocking medications such as proton pump inhibitors and H2 blockers, histamine 2 blockers. Next slide. So the essential role of stomach acid. You cannot have ideal health without stomach acid. You cannot have good digestion or assimilation without stomach acid. Gastric acid is essential for protein digestion. Gastric acid is essential for the assimilation and utilization of several essential minerals, including calcium, magnesium, phosphorus, zinc, iron, copper, and chromium, are all dependent upon gastric acid. Gastric acid assists the killing of foodborne pathogens. This is another function. People say, oh, you've got an immune issue. Well, what is your immune system? Your stomach acid is part of your immune system, in a certain sense. So there's a problem here, is that now many doctors just assume that a person has too much stomach acid. And surprisingly, there's been very little, if any, research on if this is even true or not. There has been a research hospital in Heidelberg, Germany, and they developed this very, very precise mechanism for detecting stomach acid content. This is called the Heidelberg pH test. It's the most precise way to actually measure if a person is producing too much or too little stomach acid. Dr. Jonathan Wright up in Washington, Tacoma, Washington, has done more research with the Heidelberg, the doctors that I know, has probably done more research on the Heidelberg pH test than any other physician in the United States over the past 35 years. And he's found that, according to him, the incidence of high stomach acid, hyperacidity, is almost never, you never see that. Most people, especially over the age of 35, do not produce enough stomach acid. Huh? How's that possible? How could that possibly be? Why is the acid coming up into my throat if I don't have enough of it? Turn the slide, next slide. Okay, so what are the 5 primary causes of GERD? I don't want to say that hypochlorhydria, low stomach acid, is the only cause of GERD, but it's a major, major component in many cases. Now, I'll go into why this theory of hypochlorhydria makes a lot more sense. So, first of all, the stomach has got to be acid all of the time. The stomach was produced by whoever made the stomach to secrete gastric acid. It's an essential function for biological purposes. So, what's going on here? What's actually believed to be going on is that you've got other hormones. There's a hormone called gastrin. And has anybody heard of gastrin? So gastrin is a hormone, and what it's believed to be doing is regulating the esophageal valve. There's a little valve somewhere in the center of the chest. It opens and closes. It opens when there should be food coming down, and it should close when there's food in the stomach. If you don't have enough acid in your stomach, what tends to happen is that there's an esophageal reflux valve triggering mechanism. That esophageal sphincter opens up, and whatever low amount of acid exists in the stomach is coming up into the esophagus. And that's why so many people with acid reflux take a shot of vinegar or hydrochloric acid, and their symptoms go away within 5 seconds. Has anybody ever tried that in this room?
I had chronic heartburn throughout high school and college, and when I was diagnosed with leaky gut and put on digestive enzymes in the 80s, it went away.
Just like that?
Just like that. And the doctor's functional alternative was saying, MD was saying how acid is often most likely caused by too little rather than too much, and that was absolutely true. I've never had heartburn since. It was chronic prior to that.
So hypochlorhydria is, in my experience, low stomach acid, probably the primary cause of acid reflux and esophageal reflux disease. That underlies the condition. But if there's a long-term issue and a person's been taking drugs long-term, I'm going to bet anything that there's a lot more complications that go along with that. The 5 primary causes of GERD, as I've seen them: 1, low gastric acid; 2, H. pylori infection, which we're going to look at next, proven to cause 70 to 90% of gastric ulcers. H. pylori may also cause GERD and acid reflux symptoms. 3, food intolerances, especially gluten and gliadin intolerance. There's many peer reviews that show that unaddressed gluten sensitivity is a primary trigger for esophageal reflux in many different people. Nobody knows exactly why. It probably has something to do with an inflammatory response causing a breakdown of mucosal tissues somewhere in the gut lining. Because remember, the IgA, immunoglobulin A, and all those immune defenses in the gut also exist in the stomach mucosa. If there's inflammation in the stomach mucosa because of, say, an H. pylori infection, or because of an antigenic food that's triggering an immune response, guess what? Inflammation triggered by your immune system could be causing the breakdown of your mucosal lining, which the mucosal lining in the stomach is what protects you from the acid, from preventing it from burning the underlying tissues. You have a mucosal barrier in the stomach for a reason. So two other major causes are actually misdiagnosed. 1, GERD is often misdiagnosed, but it's actually bile acid reflux. It doesn't have anything to do with stomach acid, but it has to do with bile spilling in from the duodenum into the stomach. And what's the main trigger for this? Or what is one main trigger? Not having a gallbladder, having your gallbladder removed. This is a major complaint that many people without a gallbladder experience, acid reflux. But it's not acid from stomach acid, it's bile acids pouring into the stomach. So if there's no gallbladder, or if bile reflux is suspected, they can stick a device down there to see and test the bile if it's coming up into the esophagus to see if that's exactly what it is. But I would certainly focus on clearing the biliary ducts, detoxifying the liver, focusing on that specific aspect. Another common misdiagnosed cause of GERD is actually called eosinophilic esophagitis. Now, what specifically is that? That's a condition that means that your eosinophils, which are a white blood cell, are attacking something on your esophagus. And what is one of the primary triggers of eosinophilic esophagitis? Mold toxicity. Mold antigens from ambient mold in the air being breathed in and inhaled and or swallowed in some people that have a very heightened sensitivity to mold have eosinophilic esophagitis, and it's actually being misdiagnosed as GERD when it's not GERD at all. So these are, as I see them, these are the 5 major triggers of esophageal reflux disease. Has nothing to do with too much stomach acid. I've yet to see anybody in my practice that has had hyperacidity. I've yet to see it in the stomach. Okay, next slide. Dangers of acid-blocking medications. It's well documented in the medical literature that acid-blocking medications such as proton pump inhibitors or H2 blockers may increase the risk of carcinoid tumors and gastric cancer. Long-term use of proton pump inhibitors has shown to cause osteoporosis. Why is that? Well, let's look at the next one. The use of proton pump inhibitors is shown to cause severe magnesium deficiency because of the essential role for stomach acid in the assimilation of several essential minerals, including magnesium and calcium. What are two of the most important minerals for maintaining bone integrity and the collagen matrix that surrounds the bone? Calcium and magnesium. And also the essential role of stomach acid and pepsin, which triggers the enzyme that digests protein. What is the collagen matrix that surrounds the bone? Osteoporosis is not bone loss per se, it's a breakdown of collagen, a protein matrix that surrounds the bone structure. And so H2 blockers and PPIs that block stomach acid will also be causing protein deficiency, amino acid deficiency. And so if you don't have enough amino acids and protein, you cannot regenerate tissues, and that includes the collagen that surrounds the bone. Proton pump inhibitors and H2 blockers have shown to cause B12 deficiency, well documented to cause severe B12 anemia. Proton pump inhibitors are well documented to increase the risk of all types of bone fractures, especially in the elderly. So the key point to remember is that proton pump inhibitors and H2 blockers do not address what is actually going on. They are only preventing the stomach from making acid. But again, if the cause has nothing to do with high acidity, then what's the point of taking them? Well, the doctor doesn't know that, and because there's been so little research done, probably for a reason, on what is actually causing esophageal reflux disease, let's just keep the profits rolling.
Michael, are there product names associated with PPIs that...
Prilosec, for example.
Okay.
What's another one? That's the main one that I had.
What's
The
that?
purple pill.
Nexium, yeah.
So Nexium, right. So do you have, is that what the problem is? Do you have a purple pill deficiency? You need to take more purple pills, right? That's the problem. You're deficient in the purple pill. Something else is wrong. Something's wrong with that statement. Next slide, please. One more, please hold. We've got to finish up. Okay, Helicobacter pylori, H. pylori. This is a major, major stomach pathogen. The researchers that have discovered the role that H. pylori plays in the development of ulcers and gastric cancers won the Nobel Prize in, I think, 2005. And the main researcher, I forget his name, but the main researcher back in 1984 actually swallowed a petri dish of H. pylori just to show what it was actually doing. And it took him and he was documenting what was going on over the course of the next year and a half. And it eventually, it caused ulcers, it caused all kinds of, the first thing his mother recognized was it caused halitosis, foul-smelling breath, his stools were black in color, he was getting headaches, bloating, stomach pains, and all kinds of things. But eventually, him and another researcher won the Nobel Prize in 2005 for actually showing that H. pylori infection is the cause of stomach ulcers between 80 to 90% of the time. 80% of stomach ulcers caused by H. pylori, 90% of duodenal ulcers caused by H. pylori. H. pylori is also strongly associated with gastric cancers, incites a strong IgA antigenic response, which again is going to signal inflammation activity, inflammatory cascades. H. pylori may cause GERD, acid reflux, and gastritis. Features other symptoms including burning stomach, nausea, abdominal cramping, halitosis, black stools, and vomiting. H. pylori can trigger neurological inflammation, as shown in the literature. There's tens of thousands of research articles about H. pylori. Can trigger neurological inflammation, can produce high amounts of ammonia, resulting in free radicals and superoxides. Ammonia has a toxic effect. What happens is that the pathogen harbors a substance called urea, which is a breakdown product of protein, and urea basically increases the amount of ammonia that gets produced. So what happens is that you've got all this toxicity going on. H. pylori may induce ketosis, which is meaning that your body is only burning ketones as a source of fuel, because H. pylori is unique in that, unlike many other pathogens, it is actually using fats, ketones, as a source of its own fuel. So sometimes if I'm working with somebody with H. pylori, I say, just for the next couple of weeks, just lower your fat intake until we get this under control. Sometimes that's an important thing, not always. And H. pylori can also steal several nutrients such as cobalt, which is where vitamin B12 is derived from, manganese, which you talked about earlier, nickel, as well as L-carnitine. And L-carnitine may be the reason why H. pylori is inducing ketosis, because L-carnitine is essential for normal fat metabolism. Next slide. Okay, so the dangers of non-steroidal anti-inflammatories, aspirin and ibuprofen. Reports from the medical literature. This is another major cause of ulcers. NSAIDs are well documented to cause ulcers, gastric bleeding, and serious GI complications. The New England Journal of Medicine estimates that 103,000 patients are hospitalized every year in the U.S. due to gastrointestinal complications due to non-steroidal anti-inflammatory drugs such as aspirin, over-the-counter pain relief medications. 80% of ulcer-related deaths occur with patients taking NSAIDs. At any time, patients on NSAID therapy have a 5 to 10 times greater risk of developing gastric ulcers than non-users. Unbelievable information. But many people that have ulcers, and I don't know if this is the main reason you came to this talk tonight was about ulcers, but it is one of the major stomach-related concerns that can be caused directly by non-steroidal anti-inflammatory drugs. Next slide. The function of bile in digestion. Important to discuss this because we talked about bile acid reflux. Bile requires sufficient cholesterol and water for synthesis. So many people are concerned about their high cholesterol, but what about their low cholesterol? I see this 80% of the time more than I see high cholesterol. Do you think that there's only a problem when cholesterol can be produced in high amounts? What about when it's produced in low amounts? This is even a bigger problem in my experience and opinion. The liver should secrete 1 to 1.5 quarts of bile every day. That's an enormous amount of bile. Bile is a degreaser and detoxifier. It contains conjugated toxins that the liver filters out of the bloodstream continuously every 3 minutes. And bilirubin from hemoglobin degradation. So when your body breaks down hemoglobin, which is the major protein in the red blood cells, it gets excreted into the bilirubin, and if you see an elevated bilirubin, higher than 1 on a blood test, it indicates that there may be biliary stasis, the bile ducts are backed up, or there's some liver stasis going on. Bile is essential for fat digestion and for the digestion of fat-soluble vitamins, A, D, E, and K. These are essential fat-soluble vitamins that are also antioxidants they can only be used in the presence of sufficient bile. Anybody has no gallbladder, I recommend that they should be on bovine bile salts for the rest of their life, period. Bile neutralizes stomach acid before it enters into the duodenum. That's another function of the bile. After you eat your acidified food, the food passes from the stomach into the duodenum, and it's got to be, the pH has to be lowered, it has to be raised because it's so acidic. And so the small intestine can only absorb nutrients in an alkaline environment. So bile salts neutralizes the highly acidic acid as it comes into the duodenum. So imagine what that's doing. If you don't have enough bile, what is that doing to your stomach acid, and what is the stomach acid that's not being neutralized doing to the intestinal epithelium in the small intestine? Ever think about that as a possible cause of what's going on with assimilative issues? A large percentage of GERD symptoms are caused by bile acid reflux, which again is bile pouring over from the duodenum back into the stomach and then up into the throat. Gallbladder removal surgery is shown to cause bile acid reflux and worsening of symptoms in many cases. Normalizing liver detoxification pathways is one solution to bile acid reflux. Some other people say take more fiber. Some people say take glucosterones or substances that will help to conjugate the bile and to help to get it and to move it down through the digestive process. Next slide. Okay, last section here, testing strategies and solutions. So, the brain processes and stores meaningful memories in the limbic brain. The amygdala, a limbic gland in the brain, is directly influenced by the enteric neurons in the gut, as well as cortisol and the HPA axis. The people that heal their gut modify their stressful lifestyle and their reactions to stressful situations. Ask anybody with Crohn's disease or a chronic gut disease how stress affects their symptoms. And you know what they're going to tell you? Probably everything. This has been what people have told me, that when they're under stressful situations, they have an exacerbation of their symptoms. I think what you have to look at in those cases is the effect that the intestinal enteric neurons have on the brain and on the stress response, and how that, what's called a microbiome axis, the gut microbiome axis, how that is affecting and being affected by the stress response, by the cortisol release, by those stress hormones being produced. So reducing stress is on the top of my list for repairing gut-related issues because of the implications of what cortisol can be doing on inflammation and how this is affecting cognition and behavior, as well as an exacerbation of symptoms in the gut itself. Helpful lifestyle recommendations: always recommend proper rest, 8 hours of sleep, in bed between 10 and 12 o'clock. Turn off your computers and Wi-Fi devices at night. And why is this? I have no doubt whatsoever that the non-ionizing radiation that's coming off of cell phones and wireless devices have a tremendously stimulating effect on the sympathetic nervous system, on the stress response. I can sit up late at night, and probably other people can attest to this. I can sit up late at night, and I can just stare at the computer for hours and hours and hours, and not get tired. Why am I not getting tired? Not as tired as I should be getting if all the lights were off. My body's circadian rhythms would be more regulated if I wasn't being exposed to the high levels of non-ionizing radiation. Sleep in total darkness, essential. Turn off all the lights, put a thing over your eyes. Regular exercise, emphasize stress reduction programs, yoga, meditation, qigong, and breathing. Talk to any one of the amazing practitioners in Santa Cruz who teach any of these stress-reducing practices. Next slide. Individualized diet, as I was saying earlier, there's no such thing as a one-size-fits-all type of a diet. Nutritional requirements are as individual as your fingerprints, and nutritional requirements are highly individual, should be based on your type of metabolism, what your body actually needs. Eliminate all antigenic foods that are identified through an IgG food sensitivity test or a Coca Pulse test or both. Anything that your body may have a suspect that is reacting to something, get it out of your diet. Emphasize the use of foods that heal the gut, which we're going to look at next slide. Obtaining the right lab testing. So a routine blood test, this is something that I specialize in my practice. I've analyzed probably a few thousand blood tests functionally. And you can order, anybody can order a routine blood test for $47, direct to consumer through Life Extension. I think Direct Labs is about $97. So inexpensive, you don't need a doctor, you just order it online. They send you the requisition form, you go into LabCorp on Soquel Avenue, and you have your blood taken. So a blood test could definitely give you a lot of essential information. Good to use to assess many different functions. Not ideal for gut indicators, but there are a few, as I said before. Uric acid, lymphocytes are indicators of gut toxicity. Must interpret the blood test functionally with ideal reference ranges, not conventional reference ranges. Because conventional laboratory reference ranges are statistical averages, not ideal values. IgG food sensitivity test identifies 100 to 150 potentially antigenic foods, chemicals as well as other substances. This is a blood test that you can have done. I do it in my practice. Comprehensive stool test should also include H. pylori, should include bacterial culture, yeast culture, short-chain fatty acids, parasitology, and secretory IgA. What are my top list of what are the stool companies that I probably recommend hire? I actually think Doctor's Data has the best comprehensive stool test, from my experience. Metametrics is pretty good, BioHealth is pretty good. I don't like Diagnostics as much, but they're okay too. Next slide. Use of the right supplements. So I gave everybody a list of most of these supplements, and everybody, there may be a few left. But we're going to look at these just very briefly and talk about how you can use and titrate certain nutritional supplements that are indicated for certain gut-related issues. So probiotics, digestive aids, antimicrobial supplements, gut repair supplements, and then alternatives to non-steroidal anti-inflammatories. Next slide. Let's look at what some of these are. So digestive aids, acidifiers, and neutralizers. HCl and pepsin supplies hydrogen for gastric acid, low hydrogen concentration. So the same is true for malic acid. It's an underappreciated supplement, but yet malic acid actually yields more acid than hydrochloride does. Does anybody ever take a betaine HCl with pepsin capsule of some kind? It's good, but malic acid has a higher acid content. And if you're trying to acidify your stomach, if you're trying to take more, then malic acid or vinegar is going to contain higher acidity. Typically, you have to take a lot of HCl capsules to get the burning sensation, like 2,000–3,000. If you're getting a burning sensation from taking an HCl capsule or a malic acid capsule that's causing a burning sensation, you've got a problem with your mucosal barrier in your stomach. Vinegar, high concentration, more than HCl, and ammonium chloride is another acidifier that's sometimes put into different products. So I want to talk about the bases. We talked those are the acidifiers and the bases. Sodium bicarbonate, otherwise known as baking soda, is a very strong base. May be needed for H. pylori infection protocol to temporarily raise the stomach pH. Documented effective in kidney disease when acidosis is present. I don't really recommend it outside of those particular issues unless there's some real good reason to use it. But because it will wipe out acid if you take enough of it. But the benefit is that H. pylori lives in the acid environment of the stomach. And so you want to what's called disorient the pathogen. And by taking a bicarbonate, you raise the pH of the stomach. This is the thinking of the allopaths when they give a proton pump inhibitor to somebody that has an H. pylori infection. But the antibiotics are causing a toxic effect and are not likely effective in any way. But if you take baking soda, it's going to temporarily raise the pH of the stomach. That's when you hit them with your antimicrobial herbs, like mastic gum or cat's claw. Potassium bicarbonate is a weaker base than sodium bicarbonate and may be indicated in some instances of a true metabolic acidosis, which is not very common, despite what many people think. Acidosis is not as common as you think that it is. Next slide. Enzymes and bile salts. Plant-based digestive enzymes have a wider pH range, between about 3 to 9, and they work in the stomach as well as in the small intestine. Highly indicated for dysbiosis and all types of different digestive symptoms. So if you have leaky gut, I certainly recommend anytime you eat any cooked food, plant-based digestive enzymes, I certainly recommend them and I take them myself because I want to make sure that the food I'm ingesting, the high-quality food I'm ingesting, is getting assimilated properly. Pancreatic enzymes are usually pork-based preparations, only effective in the small intestine, and they have to be taken on an empty stomach. I'm sorry, scratch that. Pancreatic enzymes can be taken with your meal, but they can also be taken on an empty stomach, and at a high dose, they may be strongly anti-inflammatory. Pancreatic enzymes are a first line of defense against cancer, as well as abnormal cell growth. If you're interested in reading an amazing book, I recommend The Trophoblast and the Origins of Cancer by Dr. Nicholas Gonzalez. Blow your mind.
Say that again, please.
The Trophoblast and the Origins of Cancer, Nicholas Gonzalez, MD. And how pancreatic enzymes also can break down pathogenic biofilms and are anti-inflammatory. Bovine bile salts are good for fat digestion, essential if there is no gallbladder. Ox bile can also be used for fat digestion as well as detoxification. Oftentimes ox bile contains dihydrocholic acid as well as other things to stimulate the liver. And it's been used for time immemorial, I think since Hippocrates using ox bile. Next slide.
Need more water?
No, I'm good. Therapeutic proteolytic enzymes, a class of enzymes studied and used for anti-inflammatory effects, anti-pathogenic, and even anti-cancer properties. The primary pancreatic enzymes that have activity are called trypsin and alpha-chymotrypsin. It's actually, I'm spelled that wrong, it's CHY, chymotrypsin. Potent anti-cancer activity, also anti-inflammatory, may work against pathogens and dysbiosis. Serrapeptase is probably one of the most potent and well-known proteolytic enzymes. Potent is sometimes if a person has gastric or digestive symptoms, or if they're having inflammation of the joints, I recommend a strong dose of serrapeptase, or also called serratia peptase. It's a strong analgesic. It can be used in place of NSAIDs or pain medications. Serrapeptase can also clear arterial plaque formation. I can document this. It may also work to eradicate certain pathogens. Nattokinase is another proteolytic enzyme. It's used mostly for blood clots, for excess fibrinogen in the blood, as well as for cardiovascular purposes. And then lumbrokinase is from a soil worm derivative, and it's effective for eradicating pathogenic biofilms. There's a product called Boluke, B-O-L-O-U-K-E. It's a high dose of lumbrokinase. B-O-L-U-O-K-E, I believe, Boluke. It's a Canadian company. But lumbrokinase is a powerful pathogen. It can also be a blood thinner, just like nattokinase can, actually better than nattokinase. Bromelain, derived from pineapple, is also a very strong anti-inflammatory, effective for breaking mucus, sinus infections. High doses of bromelain, very effective in those regards. Next slide. Okay, antimicrobials. These are just a few. You could probably list 1,000, and I'm sure there's a few people in this room that probably could. The major anti-parasitic herbs that I've used that I've found to be very effective are Artemisia, otherwise known as wormwood, and then another herb called Mimosa pudica, garlic, as we all know, golden seal, black walnut, clove, and olive leaf. Olive leaf is very strong, as I'm coming to appreciate, and has a lot of applications. I want to also talk about possible use of antifungals, which we didn't really talk about here, but antifungals like caprylic acid are particularly effective and at breaking down various excess yeast, which we didn't get too much into. Next slide. The primary antimicrobials for H. pylori, and I've seen all of these work. I've documented many cases of H. pylori symptoms eradicated within 30 days. Cat's claw, which is also known as une de gato. This is a Peruvian herb or a South American herb. Very powerful antimicrobial. And a lot of I should also mention that a lot of these herbs have a lot of other anti-inflammatory properties. These are, I'm just kind of listing them here just for antimicrobial purposes, but they have a lot of other functions as well. There was a company called Raintree, Amazon Raintree company, but they went out of business. They were forced to close by the FDA. And they made some of the strongest antimicrobial herbs, including cat's claw. Mastic gum, which is from gum resin, which is, that's the picture of mastic gum, has been shown in literature to be very strong, powerfully antimicrobial against Helicobacter pylori. Gamma oryzanol is derived from rice bran, and this has also been documented in literature to be to work against Helicobacter. Berberine sulfate, which is derived from Oregon grape and golden seal, is strong activity against Helicobacter. And then sulforaphane, which is a major antioxidant compound derived from cruciferous vegetables, is strong. Certain strains of that sulforaphane from broccoli extract, broccoli sprouts, is strong against Helicobacter pylori. Olive leaf, strong against Helicobacter. DGL is deglycyrrhizated licorice, which is low in glycyrrhizin. The major phenolic, I think they're phenolic compounds in DGL, very powerful at eradicating H. pylori as well as regenerating the intestinal mucosa, which we'll look at next. Next slide. Okay, gut repair. Some primary supplements or some protocols for repairing the intestinal mucosa. Once we get the diet in order, which is the fundamental thing, the right kind of diet for your body, repairing the intestinal mucosa, how do we do it? Well, number one, probiotics. And the right strain of probiotics. Some people need higher concentrations of bifidus, some people need more reuteri if they've got inflammation. We'll look at those. But then also fermented foods could be used, and there's a little bit of debate about this, because fermented foods sometimes can cause toxic byproducts, especially if a person has a yeast infection. They could be producing high amounts of hydrogen sulfide, which is toxic to the brain. And so fermented foods could have definitely a lot of value, but only when they're applied at the right time. If a person has a yeast infection, not going to indicate the use of fermented foods yet. L-glutamine powder, which is an amino acid, is highly indicated for gut mucosal repair. I've seen that work miracles in some cases, at a dose between 1,000 and 3,000 milligrams a day. I've also seen it fail. Okay, there's no one-size-fits-all, but it certainly could work. And it's certainly going to be on my list at least to try initially. It's inexpensive, easy to get. And glucosamine. Glucosamine is another, what glucosamine is called a glycosaminoglycan. And it also, other glycosaminoglycans are chondroitin sulfate and hyaluronic acid, which a lot of people take for joint inflammation, right? But you can also take this for intestinal mucosal barrier repair. And some of the richest sources of glucosamine include bone broth soup. Take the bones, chicken bones, beef bones, lamb bones, boil them down in water for hours and hours and hours, and then consume that. That's rich in minerals. That's rich in glycosaminoglycans. It's rich in glutamine. Some cases, and again, it can get unbelievably specific. Some people have a glutamate sensitivity and they can't even do the bone broths. But gelatin, which is also going to be found in bone broths. Proline and glycine, the amino acids that regenerate connective tissue, are found in bone broths. There's a special nutrient called zinc L-carnosine, one of the best ways to repair the stomach mucosal lining, as well as any other mucosal lining. Zinc L-carnosine, documented in the literature to repair the mucosal barriers. A form of aloe called L200 is very effective, and aloe has been known for centuries to be healing to the gut. Deglycerized licorice, low glycyrrhizin, which means you can take it even if you have high blood pressure because the glycyrrhizin has been removed, but this has also been shown to be very effective at modifying the mucosa of the stomach. Is licorice an adaptogen, or is it considered more of a tonic?
Tonic.
It's more of a tonic, more of a tonifier, right?
Harmonizer.
Harmonizer. Phosphatidylcholine, this is a phospholipid, essential for repairing intestinal epithelial cells. Short-chain fatty acids from butter. Short-chain fatty acids cause the intestinal flora to proliferate. And so butter is an extremely rich source of SCFAs. Your gut, no, your healthy intestines will make some amount of SCFAs, but it's good to do a little bit, especially because butter is so good. And everyone's laughing. And you can eat just spoonfuls of this stuff. Slippery elm. Slippery elm contains a certain kind of mucilaginous substance that helps to proliferate certain forms of bacteria. Gamma-oryzanol from rice bran, and then okra, as a special mention, has been used in Ayurvedic medicine for a long time for helping to heal kind of the mucilaginous, sticky substance to help heal the gut. Next slide. Go ahead.
Can I add in the one you know I'm going to add in?
Please.
Comfrey.
Oh, I didn't put it on there. Thank you.
Yeah.
Comfrey root. Craig wrote a great article for me last year about the healing benefits of comfrey, the regenerative anabolic effects of comfrey root and comfrey leaf, right? Both the root and the leaf.
Yeah.
And the FDA has come down hard on it in the last few years, even though it's been used internally for how many thousands of years? I don't know. But comfrey is something that Craig can formulate for you. Gut repair probiotics. So I'm going to kind of almost done here with this whole presentation, but there's multi-strain probiotics, there's soil organisms, then there's a certain kind of a probiotic called Saccharomyces boulardii, which is indicated for various yeast infections, like candidiasis or bladder infections as well. I've seen it work well with. If you're taking antibiotics for any particular reason, I always recommend Saccharomyces boulardii without hesitation. Also, if you're taking any herbs that are antimicrobial, you want to take a probiotic with it, just so that if you're killing off anything that's good, it's constantly being regenerated. Although that's probably not going to have the same effect that an antibiotic would, which would be more toxic. Lactobacillus reuteri. This is a specific probiotic that I know that health food stores carry, and I think Way of Life carries it. Lactobacillus reuteri has been documented in the literature to modulate the inflammatory response in the intestines. Inhibits tumor necrosis factor alpha, which is one of the major cytokines that triggers inflammation. Reuteri has been shown time and again to be powerful at modulating inflammation. And then Bifido infantis, and there's a specific strain called Bifido infantis 35624, which is shown in literature to be extremely effective against irritable bowel syndrome symptoms. Prebiotics include inulin, glucomannan, guar gum. These may not work well for some people because prebiotics not only feed good bacteria, but they can also feed pathogenic bacteria as well. So if you have pathogens going on, you may want to just be cautious with adding prebiotics. You get a lot of gas or bloating from taking prebiotics. It's probably good to...
Klebsiella, I've read.
Klebsiella. Prebiotics feed Klebsiella. Thank you. Short-chain fatty acids, butyrate, propionate, acetate, produced from carbohydrate fermentation in the gut. They help to nourish the mucosal cells, assist probiotic colonization. And then these specific probiotics have been studied for affecting mood and behavior, having an anti-anxiety effect by modifying the enteric neurons, which talk directly to the brain via the vagus nerve. Lactobacillus reuteri, Lactobacillus helveticus, Lactobacillus longum, and Lactobacillus rhamnosus have all been shown to have anti-anxiety effects. Modifying GABA in the central nervous system, reuteri and rhamnosus have also been shown to do that. And then for antidepressant effects, Bifido infantis 35624 has been shown to have antidepressant effects. Next one. Yep.
Are those all probiotics, or is that what's in?
These are all, those are all specific strains of probiotics, individual strains.
So you can't just buy one?
Sometimes you can.
Okay.
Yeah, some companies do make that.
Okay.
Definitely. And then I want to just give this, alternatives to non-steroidal anti-inflammatory drugs. We do not need to be using these drugs if we're addressing the core of our issues. If we're addressing the root of causation, the root of dysfunction, the use is not necessary. But we could use nature's botanical pharmacy as a way to help modify these. Boswellia powerfully inhibits lipoxygenase expression, leukotriene synthesis. Boswellia is also known as...
frankincense.
Thank you, frankincense. Curcumin from turmeric inhibits both cyclooxygenase as well as lipoxygenase, Bromelain from pineapple, a systemic enzyme that's anti-inflammatory as well. Serrapeptase, powerful proteolytic enzyme. I get so many amazing testimonials about people taking serrapeptase in so many different applications. And if you take enough proteolytic, I want to say that if you take enough proteolytic enzymes, it has a calming effect. High doses especially high doses of good pancreatic enzymes like intenzyme forte, has a very parasympatheticizing effect. It can actually calm the body. Willow bark inhibits the COX inflammation and is a safer alternative to aspirin and NSAIDs. Licorice root inhibits phospholipase A2 and the arachidonic acid cascade. And of course, ginger, potent anti-inflammatory, quercetin. Butyrate and proprietary alcohols, which is another discussion for another day. But organic alcohols have a potent anti-catabolic effect. And catabolic means basically the process of breaking things down into smaller and smaller. Anti would be anabolic. Yeah. Anti-catabolic would be anabolic. Yep. Maybe if you can look at that one. Well, talk to me afterwards. Less later. Omega-3, DHA and EPA inhibits the same pathway that aspirin inhibits, the prostaglandin E2 pathway. And that's why so many people with different pain can take omega-3 fatty acids and they feel, oh, my bursitis is gone, oh, my headache is gone. But I will say that many people overdo omega-3 fats, and I should say that omega-3, just like any other unsaturated lipids, are going to have a potentially catabolic effect, that they can actually incite inflammatory activity via the breakdown of vitamin E from cell membranes, in high levels will cause inflammation. But in normal amounts, which is probably a lot lower than most people consume nowadays, it certainly has some benefits.
Is there a food base for the serrapeptase? Is there...
Serrapeptase is derived from the intestines of silkworms. So it's a specific extract from a specific...
So there you go.
Yeah, there you go. Just eat a bunch of raw, live earthworms, or silkworms.
What about cooked silkworms?
I don't know, because you'll cook any enzyme will be destroyed above 105 degrees Fahrenheit.
Okay, so you can only get it in a pill form.
Should always be raw and unprocessed.
Don't take it.
You can eat the raw silkworm. That's totally an option. I'm leaving that open. All right, next slide. All right, thank you very much. That's the presentation. We'll take a few questions. If you have to leave, thanks for coming, but we'll take definitely a few questions. Yes, in the back.
So the last two slides, can we get copies of those?
So, I want to say this, that I had printed out, I have a 5-page document with all the supplement, an alphabetical list of every supplement that was talked about on here, and every specific effect that they're basically indicated for, that I will email to you if you send me your email address. And if you want the slides, I'll give you the slides. So just leave your email address on that form. Question? Yes? Yes, my website is www.metabolichealing.com. Metabolichealing.com. I've authored 300 articles on my website, mostly research oriented. Yes?
Can diverticulitis be reversed?
Totally. Yes. Yes.
Could be it could be a very effective, communication technique.
It depends on each person. I mean, I never recommend more than 2 teaspoons a day.
How are you?
But some people I say no omega-3 fats. None. Don't have any. In some cases. Not everybody responds well.
We've been making a little powwow.
Any other questions?
He rocks, isn't he great? He's a great guy.
Yes, I live just around the corner.